These are health experts and young researchers across Africa who launched a pilot study aimed at finding innovative solutions to HIV/AIDS prevention and treatment among adolescents and young people in high-risk communities. The initiative is a collaboration involving Inspire, Patch In, the National Institute of Medical Research (NIMR), and other universities, with a focus on strengthening interventions for young people affected by HIV across the continent. At the center of the project is Patch In, prevention and treatment through a comprehensive care continuum for HIV-affected adolescents in resource-constrained settings, Implementation Science Network.
We have a game-changing intervention that can ensure that we begin to achieve the vision of ending the HIV epidemic among young people. It's called lenacapavir, and if many of our young people, especially those engaging in risky behaviors, can get the injection twice a year, that vision of ending HIV is within reach. And so we're here asking that same young people, wherever they may be across Africa, so not just Nigeria, across Africa, to come up with ideas that they believe would allow us to scale up lenacapavir so that we do indeed reach many young people and realize that vision of ending the HIV epidemic.
Organizers say the network represents an expansion and improvement on its predecessor patch, broadening its reach to new geographic areas where implementation science research capacity remains limited and HIV incidence among young people remains high.
Looking for ideas that are really simple, that are very easy to integrate into existing systems. We're looking at ideas that young people will find interesting, that it will be easy for them to key into. And of course, scalability, sustainability, very important, or at least it should have a huge impact. The Inspire organization and movement is one that ensures that ideas come to life, that they become solutions for persons, and we know that this drug, lenacapavir, is a game changer. It's going to make sure that HIV is one that's going to be preventable to a higher degree, and even for treatment of HIV as well. So here we're in a room of young people innovating for young people, and the ideology behind it is also fantastic.
A lot of innovative strategies or innovative preventive strategies that exist out there. Of course, we know about PrEP, pre-exposure prophylaxis, so which is important for you to take for individuals who might be at risk. And of course, there are other preventive ways for HIV, condom use that is highly encouraged. In terms of like the communities and what is most effective, the effectiveness really comes from the uptake of these innovations. As mentioned, these innovations exist, PrEP exists, there are other ways you want to get tested. You have testing, HIV self-testing, as well as the testing you do in the clinic. This exists, but the effectiveness of them really lies in the uptake. So the more people you get to use it, then the more effective they are, because they've been found to be effective from research. Is now really ensuring that we're working with the community.
Stakeholders say many of these interventions have shown effectiveness among adults and are now being adapted to address the unique realities of adolescents. Beyond prevention and treatment, the initiative seeks to bridge the gap between research and public health practice by translating proven interventions into practical, scalable solutions.
You can't talk about HIV/AIDS without talking about young people in Nigeria. Prevalence among young people is high, most especially among key populations and among adolescents and young women. So definitely you can't talk about HIV/AIDS without talking about the young people in Nigeria. And for this event, young people are taking the lead to provide the solution on how to reach them with information, most especially prevention. Because most times it's always when people get infected, then you refer them for treatment.
The program is designed to evaluate innovative prevention strategies targeted at HIV-negative youths and vulnerable communities, while also improving treatment and care intervention for adolescents living with HIV. Experts say the long-term objective is to reduce new HIV infections among young people, strengthen access to treatment, improve retention in care, and achieve sustained virus suppression, particularly in low and middle income countries across Africa. The pilot study is also expected to strengthen implementation science research in a critical but often neglected area of public interest, while placing young people at the center of designing solutions for their own future. Adenike Ajiboye, Superscreen News.